Today we're diving into something we all use every single day, the language of health. We're talking about the specific words we choose when we're feeling sick and when we're feeling great. And it might not seem like a big deal, but you're going to see how using the right words can make a huge difference in the care we get and even how we feel. I mean, haven't we all been there? You're feeling off. You're trying to explain it to someone, maybe a doctor, and the words just don't quite fit. It's so frustrating, right? And believe me, it is a way more common problem than you'd think. Just look at this. It gives you a sense of the huge range of language we have for our health. It's like having this entire toolkit. Everything from the simple phrases we use every day to the super precise, formal terms a doctor might use. Getting a handle on this toolkit is pretty much the key to navigating our own healthcare. All right, so let's start our little journey right at the beginning, with that first little sneeze or cough. This is where we use all that everyday informal language for when we're just feeling a bit under the weather. Okay, these phrases probably sound super familiar, right? We don't just say we have a cold, we have a streaming cold. We don't just get rid of it, we're trying to shake it off. Linguists call these collocations, basically words that just sound right together. It's the simple, direct language we all reach for. And this is where things get really interesting. The language totally shifts depending on who you're talking to. You tell a friend, I caught a cold. But what does a doctor say? You've contracted a virus. Same exact problem, but the language is from two different planets. It's the difference between saying you got a bad cut and hearing a medic describe it as sustaining a serious injury. Okay, so let's say your symptoms just aren't letting up, and you decide, all right, time to see a professional. This is a really key moment in our journey, because now your ability to describe exactly what's wrong becomes absolutely critical. So first things first, let's get a key term straight. An ailment. What is it? Well, it's generally a minor illness. Think of the usual suspects we all get from time to time. A headache, a cold, that nagging dull ache. It's the kind of stuff you'd see a doctor for, but it's not usually something life-threatening. And this is why being specific with your doctor matters so much. Is the pain a dull ache, that constant throbbing feeling? Or is it a sharp pain, something that just hits you all of a sudden? These words are like clues in a mystery for your doctor. They're vital for figuring out what's really going on. And look, this is where that clear communication totally pays off. Because when you can describe your symptoms well, the doctor can prescribe the right course of medication. And when a patient responds well to treatment, well, the end goal we're all hoping for is to make a full recovery. This really shows the power of using the right words. But sometimes the story takes a much more serious turn. And when that happens, you'll notice the language changes completely. It gets way more formal, way more precise, and it just carries so much more weight. So here's a really critical difference you need to know: an ailment versus a chronic condition. A chronic condition is something that sticks around for a long, long time. Think asthma or diabetes. The word chronic itself tells you this isn't something you just shake off in a few days. And this is where the vocabulary gets incredibly stark and really powerful. Phrases like critically ill or fighting for one's life. There's absolutely no misunderstanding what that means. We talk about someone falling into a coma or hopefully coming out of a coma. And then a phrase like terminally ill, that's a diagnosis that is just completely unambiguous. The diagnosis itself is always delivered with this very precise, very formal language. A doctor isn't going to say someone got cancer. They will say the patient has been diagnosed with lung cancer, or that a person has developed Alzheimer's disease. These aren't just words on a chart. They're life-changing phrases. And that formality, it's there to reflect that immense gravity. But okay, even when things are really serious, there is a path forward. So now, let's look at the language of treatment and recovery. And this is all about process, procedure, and, well, hope. Think of the hospital journey as having its own unique map with its own specific vocabulary. It often starts with seeing a specialist. Then come the tests, maybe some x-rays or scans. If you need it, the next stop is an operation. And then your recovery begins on the ward. Knowing these words can actually make the whole thing feel a little less scary. And you can see here, this is all about the specific lingo of the hospital. It's not just the surgery room, it's the operating theater. And you don't just recover in a room, you're on a ward. It sounds like a small thing, but knowing these terms helps you understand exactly what's happening and where you fit into the process. But, at the end of the day, no matter what the procedure is, the language of hope is always there. The goal is always to make a full recovery. We talk about needing to get over the illness. It's like these phrases are the light at the end of a very long tunnel. All right, and that brings us to the final part of our journey. And honestly, maybe the most important part. We're going to pivot now, away from the language of being sick and into the language of staying well. This is all about being proactive. So I'm going to ask you directly, just like it says here. Are you in good shape? Do you take regular exercise, eat a balanced diet? This is a really good time to just stop and think about the words we use for our own well-being. And check this out. This is the language of action. It's not passive at all. It's about doing things. We take vigorous exercise. We eat a balanced diet. We actively build up our strength and build up resistance to disease. We get vaccinations. We work to keep fit. Honestly, this is the vocabulary of taking control. And of course, being healthy isn't just about what you do today. It's also about planning for what if. So the language of wellness isn't only about the gym and what's on your plate, it's also about the practical stuff, like having health insurance to cover you just in case. And that brings us right back to the big question, doesn't it? We've gone on this whole journey, from a simple sneeze all the way to proactive wellness. So how can using the right words, knowing when to keep it simple and when you need to be really, really precise, actually help us take better control of our own health? Thinking about that might just change how you talk about your health from now on.